Hello, everyone. My name is Steve Hendrix, and I'm the president here at m.Care. This is the second podcast in our series. This will be our first podcast with Dr. Tom Hale. I'll introduce him here in just a second. Dr. Hale will be with us for a three-part series. Tonight, we're going to focus on really kind of the state of the healthcare industry. The second podcast will be a little deeper dive into Dr. Hale's role at Mercy Virtual and their virtual care center, which was really the world's first hospital without a bed. And we'll talk some more about that in the second podcast. And then in the third and final podcast of the series, Dr. Hale will share with us kind of how he sees the future of healthcare delivery and what that means for all of us. So we're excited to have Dr. Hale with us for this portion of the m.Care podcast series. Hello, Dr. Hale. Are you with us tonight?
Steve, right here.
Hey, great. Thank you for joining us. In our first podcast, I shared with the audience the objective of these podcasts, which is really to bring industry leaders, innovative thinkers, really to the audience and share with them what's going on in the healthcare industry, relevant to telehealth, relevant to virtual care, relevant to technology. And so we're excited to have you with us here tonight. And so maybe I'll just give a little background on you, if that's okay, and then you can fill in any cracks. So what I like about Dr. Hale, and we have known each other now for several years, is he's both an innovator and a disruptor. And I really love that about the way Tom thinks and about the way he goes about how he views the healthcare industry. He's currently involved in many projects, but most recently, when I met Tom, he was the executive medical director at Mercy Virtual. So more on Mercy Virtual later, but Dr. Hale, please tell us a little bit about yourself and your experiences leading up to the present.
Sure, Steve. A lot of what I have to say probably relates to my age, so it may sound like a resume that never ends, but I had a PhD, obtained a PhD in pharmacology, which then led to a medical degree at the University of Missouri, following which I did my internship and residency in internal medicine and started private practice. During those early years of private practice, it was also the time that managed care was being introduced to the clinical delivery models. And a group of physicians, including myself, felt that we would not do well unless we started to organize. And so we formed a medical group of 17 physicians, which then grew later to about 360 physicians in conjunction with our local health system, the Mercy Health System. I was the president of that group for 15 years, and then later was the lead physician on our Epic implementation, which actually was over 40 hospitals and 2,700 integrated physicians. And at that time, our CEO asked me to move into a innovation center, and so we started this innovation center, which very rapidly evolved into honestly virtual care. With virtual care being the data or analytics, the technology involved, and also maintaining the relationships with patients. So I was the executive director of the virtual care center and was the clinical architect for our 150,000 square foot Disney World of virtual care located here in St. Louis.
Excellent. Well, thank you, Dr. Hale. So I want to move into another topic. That's the state of the healthcare industry. And I want to read something to you. In a recent interview, Michelle Stansbury, Vice President of IT Innovation at Houston Methodist, said her advice to healthcare organizations is disrupt or be disrupted. So in your opinion, what is going on in the industry, and what is your reaction to Ms. Stansbury's quote?
And so I would agree with her. And I think it's been the case actually with healthcare for centuries. But most recently, I think historically, healthcare has been a hospital care dominated delivery model. And the hospitals and health systems had an artificial exclusivity mostly secondary to the technology and licensings and regulations, caused a environment that physicians needed to practice their trade within the hospital walls. So this conditional monopoly, which thrives in a fee-for-service model, payment model, did very well for several decades. But then over time, it became evident that that a number of things changed. One is the technology changed, the data and analytics changed with the advent of the computer, then the internet, and later the electronic medical record. And costs became untenable. There was really not enough money to keep doing what we were doing as a healthcare delivery system. Mm-hmm. So, as in the fee-for-service world, your revenues decrease. You just increase your utilization. You balance the books, and you increase prices on new technology because no one really sets a true pricing transfer model around that technology. As plans gain negotiating strength, interestingly, hospitals and health systems began purchasing physician practices and consolidating those physicians, mostly in order to continue to increase the monopolistic leverage that they had and to maintain their margins and prices. However, because of the technology and data changes and because of the problems with cost, things began to change. And they changed reasonably rapidly. When I was an intern, it was really interesting. We did cardiovascular surgery on a patient, and they stayed in the hospital 2 weeks. They're now doing some of that as an outpatient, for God's sakes, 24 hours, right. 1 day in the hospital. They're repairing AV malformations and septal defects with catheters. Once again, as an outpatient. So as all that evolved, the shift became in the importance of where the value was derived. Where before the value was seemed to be all in the hospitals, it now became the value became to reside with the physicians, particularly the primary care physicians. And so as that shifts, we're starting to move into a new paradigm, and value payments have taken hold. Which says that basically that we will pay you more if you keep people well, and we will pay you less if you overutilize and people get sick. It's actually not a bad concept, but we have a health system that has not been prepared for that type of almost crisis type change.
Yeah, I totally agree. That's the big conundrum right now is the value-based versus fee-based, and changing mindsets and then putting models in place to take advantage of that. So I totally agree 100% with that. So any other thoughts on the state of the healthcare industry or disruptors that are happening outside of what we're going to talk about in our next series, which is what happened at Mercy Virtual and others? Any other hot topics that you want to hit on tonight?
Well, I think the other thing to bring up is to understand that the non-traditional sources of healthcare delivery are starting to develop. You see Google getting into the healthcare industry. Walmart is in the healthcare industry. They all have certain skills and qualities that allow them to think that they can start to move in that direction. But what was once, as I said, a monopolistic purview of the hospitals and the physicians who work within those hospitals now is opened up to a much broader group. And what I think actually at the end of the day is probably a better care delivery model, which will concentrate on the patient, will concentrate on service, and will find ways to broaden the ability to manage populations and decrease costs.
Yeah, I couldn't agree anymore. So anyway, thank you, Dr. Hale. This has absolutely been enlightening and informative. Really looking forward to our next two podcasts. To the audience, thank you for your time today. Again, my email address is steve h@m.care. And what I would encourage you to do is send me your questions, and I promise that we will get to them on future podcasts. So if you have any burning questions about what you heard here on this particular episode or previous ones, be sure and send those to me. With that said, that's a wrap. Take care. Goodbye. We'll talk soon.